So really, in an osteoporotic bone, both the hard part of the bone, the mineralized part of the bone, as well as the living tissue part of the bone are declining?
So here's the challenge with this disease. The current diagnosis for osteoporosis is with a bone density scan, and that
Right.
only measures the hard part, the
Right.
mineral content of the bone, which becomes porous. And so likely both are degrading, and there are some tests, some laboratory tests that can be done to look at the collagen content of the bone and if it's being excreted at a high rate. But there isn't really any good test specifically to quantify the amount of collagen that's in the bone. So theoretically, we assume that both are breaking down, but there really is not any test for the collagen that can quantify that.
Right. So it's almost as though our testing, we only have the ability to test accurately for bone density, but that's almost kind of led us astray, if you will, to focusing all our therapeutics on improving bone density at the expense of neglecting the collagen and the tissue part of the bone, perhaps.
Yes, and that's one of the challenges that we currently have in the state of medicine in general, is we're always only as smart as our smartest tests or our smartest clinical instincts are.
Right.
And I like to say if you're asked the wrong question, you're getting the wrong answer. And the best treatment comes from the best diagnosis. And when you're basing your entire diagnosis just on a bone density test, you're missing the majority of the problem. Because the real issue with osteoporosis and the real danger of osteoporosis is not, do you have a low bone mineral density test score? That's a number on a piece of paper. It's, are you going to break a bone?